Right. Today we are going to discuss about back pain, the most common problem a physiotherapist encounters in his clinical practice. So, back pain usually occurs in any individual and in every individual once in his lifetime. So there are several types of back pain. So back pain is not at all the same. Every back pain is not at all the same one. So there are different types of back pain. So what are the various types? Here we are going to look at. The first one is due to spondylosis. The second one is due to spondylitis. The third one is due to spondylolisthesis. The fourth one is due to some other reason, maybe due to muscle spasm or somewhat like that, or due to improper positioning like that. So, what we are going to do treatment-wise for this back pain. So, if you look at the treatment part here, so for example, in young individuals, there will be usually muscle spasm of the back muscles. So, to relieve this muscle spasm, what we have to do? The first thing is the iliopsoas stretch. So, this relieves back pain in young individuals or due to muscle spasm in an effective way. So, how do we perform an iliopsoas stretch? So, iliopsoas stretch can be performed in both supine and prone lyings. So, iliopsoas stretch while performing in prone position. So, the therapist has to hold his, patient's knee and hip to the upward side. So, this is an effective stretch of the iliopsoas muscle. So, by performing this iliopsoas stretch, muscle spasm can be relieved in an effective way. So, other than this, there is unilateral back pain. So, how to relieve this unilateral back pain? So, coming to the treatment part of this in physiotherapy department, unilateral back pain or unilateral pain can be relieved in patient supine lying position of the patient. So how do we perform this unilateral quadratus lumborum stretch? This is actually called technically quadratus lumborum stretch is what we are going to do here in this unilateral back pain. So how do we perform this? So for this also patient is in supine lying. So after the patient is made to lie in supine position, we have to hold his head and his hip joint unilaterally, in a similar fashion, and we have to bend to the opposite side, so where there is no pain. So this is an effective stretch of quadratus lumborum. So after this, we will come across with this what you call general back pain due to improper positioning or improper positioning of this what you call improper positioning of seating at office and during driving. So how do we relieve this back pain effectively? So to relieve back pain generally, so there are some 3 exercises that can relieve back pain instantaneously. So the first one is patient is made to lie in supine position and his one of knee joint is made to pull towards the chest of the patient. So this is an effective stretch of the spinal cord. So hold it like that for at least 10 seconds. So this effectively relieves back pain. So the second one is flex both the knees and hold it like that for at least 5 to 10 seconds again. So this again causes a complete stretch of the spinal cord. So one can also feel when one is lying in supine position, especially when one is bending both of his knees. So you can feel the spinal cord is touching the surface of your cot. So the last one is one can perform spinal cord stretch in standing position also. So how do we do that? So when patient is in standing, so he should be asked to stand on his toes first. So after making him to stand on his toes, then he has to stretch his both hands towards the ceiling of his room. So to avoid confusion, I would like to demonstrate here myself by showing to you what are the various positions to relieve back pain effectively. So come, let us see. Abhisin. Right.